know, it's oftentimes the difference between the front of the body and the back of the body. We know that we need to move more. We end up going to the gym to try to lose some weight, and when we get there, we do the things that actually cause the tightness in the front of the body, which already exists, and we don't really take a look at the back of the body too much. So typical exercises that one might do when they go to the gym is bench press, leg extension, treadmill, or bicycle work, and that all exacerbates the pre-existing conditions that are already present. So what we need to do, and what the Lose the Knee Pain system does, is it gets a hold of the back of the body. So your glutes and your hamstrings and calves, gets you moving freely and strong again to balance the front side of the body with the back side of the body. So then we begin to look at the outside of the knee or the upper leg bone versus the inside. The outside muscles are often very strong and they're anatomically designed much larger. So what we need to do is get to the inside of the leg stronger so that we can start to relieve some of the pressure on the knee joint. As we spoke of earlier about the Q angle, the angle at which the upper leg bone runs from the hip to the femur, especially in women, the wider the hips, the greater the angle, which can pressurize the inside of the knee and cause pain on the inside of the knee. The next thing that happens in relationship to working out and having weak posterior chain, in other words, the muscles in the back of the body, the glutes and the hamstring especially, is that when you go into the gym to work out, and this particular exercise really takes a bad rap, which is the squat. What happens is that we try to gain balance by bringing the knees inward instead of forcing the knees outward to gain the balance. So that adds an extra angle to the knee joint that it doesn't really like too much. And in addition to that, then we go on to the knees being forced over the top of the toes because we are so quad dominant or anterior chain dominant. So once we can get the strength back into the glutes and back into the hamstrings and push our body back, then we're faced with the challenge of having a weak core. So that's the next thing we want to address, is to be able to breathe properly through your movements and to address the core being weak, get that stronger, which is going to help support the hip complex and allow you to do these exercises that are going to really promote the strength that you need to hold that joint together, as well as take the pressure off of the joint.